My name is Jyotishma. I am a registered nurse, and my designation here in this facility, which is Samabulai Health Center, is zone nurse.
My name is Sakapo Elaverua. I'm currently the subdivisional nursing manager in Netesiri. So I looked after mostly the public health nurses within the Netesiri subdivisions.
I'm Sangeeta Sharma from World Health Organization. I support Ministry of Health with COVID-19 vaccination.
So probably one of the challenges is in terms of manpower. These days are getting tired because they're doing vaccination, the mass screening, now they're doing school visits, and now back to Pfizer vaccination, they're going out. And then on top of that, they have to think about the other role that they have to play.
It has been overwhelming, I would say. In the beginning, there were long queues. In the Suba subdivision, there were thousands of vaccines given each day. The staffs were tired. We had a lot of expectations from the public.
I remember one day one of the men was really talking harsh to me, saying that vaccine, that what we're doing is wrong. There's no COVID-19 disease, and this vaccine is, it's not right to give them the vaccine, but then we had to correct them.
In Fiji, there are hard to reach areas. For example, we got remote islands, we got highlands, and we got right interiors where it's quite difficult to reach.
In terms of transportations, the team are ready to go out, but then we need to look for transport to take that team to the field.
We have to do a microplane with the subdivisions and the divisions. So through the microplane, we have to walk from our end. For example, if they are using boat to reach this population, we have to provide fuel, or they need transport, so we have to provide the type of transport they require.
We have the village headmen, we have the community health workers, and we also have the church ministers in the communities. Yeah? So we've done our engagement training with this group, and the other ones also went out to encourage the communities.
We decided to have this risk communication and community engagement in training our community health workers who can be the advocate in their community. We involved social groups, we involved religious groups, church leaders.
So I believe for any vaccine delivery, accessibility is the most important. We have been doing vaccinations in our community, in my settlements as well. In addition to that, we have also been going to some workplaces and to the schools as well.
So we've been to the furthest villages. We've been to Tumbaro, that's the furthest, which we have to walk 3 hours, crossing the river 28 times. We've been to Roma, we've been to Nakinda. Those are the hard to reach communities that we have within our subdivision.
We had to walk to find ways how we're going to vaccinate people in their own bubble. So we thought of opening a drive-through where people come in their car and they can vaccinate it and then they can go.
So I believe what services we're providing to them is also a big factor whether the community is going to come out and reach to you to get the vaccine or not.
Yes, WHO has been always there to work very closely with Ministry of Health in COVID-19 preparedness and vaccination rollout. Firstly, by providing technical and support officer like me, who provided technical assistance in vaccination rollout, for example, operation, logistics and administrative work. Secondly, WHO with evidence-based guidelines and recommendations on COVID-19 vaccines. And thirdly, WHO closely worked with UNICEF and Ministry of Health in preparing and getting awareness material, for example, brochures and information booklets to keep public informed about COVID vaccines.
We're giving dose 4s now, which is booster 2. Getting a booster dose is important because it basically boosts your immune system. Now, if a person comes in contact with the virus, the immune system is reminded on how to fight off the virus.
We fail to understand that we are the ones getting COVID, but we're taking it back to the vulnerables at home. But we need to be vaccinated in order to protect us and also protect our family.
So I encourage all the Fijians who are eligible to come and get their booster doses or even their first and second doses if they haven't received it.